Good afternoon and welcome to the August Lunch and Learn. Today we are going to be talking about going back to school, and it's a new year, but we're still having some of the same concerns. My name is Nicole Anjum. I am the Virginia Family Network Program Assistant, but today I'm definitely not speaking in a professional role. I'm just sharing as a parent things that I noticed about this year and going back to school, and just sharing it with the other parents and caregivers so we can have a conversation about going back to school this year and what that's going to look like for our kiddos. So this year, or today, we're going to be talking about how this year there's two ways to go back to school, and very much the same as it was last year. And we're going to talk a little bit about mental health and what that looks like when we're going back to school for our kids and how we can help with that. And I'll share some resources and some opportunities to connect with other parents. So like I had said, we are able to go back to school in two different ways. Although 90% of the kids are going back in person, virtual is still going to be offered as a way of maintaining social distance and safety. And it's really helping with the kids that are having a lot of anxiety about going back to school. But I also think that schools have found that some kids really are learning much better online. It's really helping with their way of learning. So when it comes to virtual school, we are able to focus on prevention. It really helps with that social distancing and helping people feel really safe about going back to school and still learning and having a good learning environment. It's really thinking about the students' needs. Again, thinking about their safety and how they learn best. It's a new flexible way. It's really becoming a good way that students are able to use their skills on how they're able to learn, especially when there's teachers that are pre-recording some of the classes. So for students that learn better by hearing it, they can listen to that recording over and over. Or even if, like my daughter who likes to write all her notes out, but needs a little extra time to stay caught up and follow along. And it's improving technical skills. We are now in a world where everything is computer based. So it's really helping with those typing skills and learning how to be on Zoom and any other way that the kids are, having to use technology. And a lot of jobs are very technical based now. So it's really helping them in the future too. So then when it comes to in-person schools, schools are set up to be very safe. They're still doing the social distancing, and kids of all ages are allowed to bring water bottles so they don't have to worry about sharing the water fountain. It's an enriching place for our kids to learn. And for those that learn best by having that one-on-one instruction or having that structure of what's needed to keep them in the mindset of this is a school day and this is how we're going to do it. For my youngest son, when they had the online school days at home or the asynchronous days, it was really hard for him because he couldn't stay in that mindset of I'm supposed to be doing school things now. What he was realizing that, but I'm home, I can turn on the TV, I can go ask mom questions, I can get up and walk around, and there's no one here to stop me. it helps the teachers. They're able to read body language of students a lot better than you can on Zoom. So they can see better if someone is struggling with understanding the content or just having a hard day, and they're able to meet their needs. And like I said, students are more likely to pay attention when they are in school because there's less distraction. But again, when you have that virtual option, some kids are really good at just paying attention because that's what they're really good at doing, is being able to do it online. And when you're in school, you have access to the support services and mental health services that really help the kids with doing what they need. So there is a mask mandate for this year. The governor of Virginia has made wearing a mask in school from kindergarten through 12th grade mandatory. But I also know that a lot of the colleges, if you are on campus and in person classes there, there's a mask mandate there too. So their schools, no matter what grade or level you are at, is really working hard to try to keep everyone safe. And this is irregardless of what your vaccination status is. So no one has to feel pressured into getting a vaccination if they don't want to, or feeling like they're vaccinated, but if they still get sick and who was the cause. It's really creating this feeling of safety. And it really helps that they all have masks when they're not able to social distance. Kids are still getting recess, so they're going outside. And how do you tell little kids that are going down slides or playing on swings that you still have to social distance when they really just want to play together and have a little bit of normalcy? So there is some help there. And then for school lunch and school breakfast, as the pandemic continues, the state is providing free meals to all children. So anyone that is going to public school, kindergarten through 12th grade, is able to get free breakfast and free lunch. You may have to get a hold of your specific school or your school district to find out more about their nutrition program. And for virtual students, they are able to pick up meals. Sometimes it's a once a week pickup and you get all your food for the week. Some do it every day. You come by and pick up your breakfast, your lunch, and then some are doing staggered days where 2 or 3 days a week you can go by and get a couple of days worth of food. So all kids are now able to have a good lunch and a good breakfast while they are learning. And this is supposed to also be able, even if the kids are sick or they have to stay at home, that they're still able to get their breakfast and lunch for the year. So we know with COVID and now all the new variants that are coming out, things are forever changing. So we just need to remember and give a little grace to the schools as they're trying to work out things. My son started year-round school this year. So not only have they tried to figure out a schedule and what that's going to look like when you go to year-round school, but they have to come up with plans for if there's an outbreak in the school, how are we still going to continue to teach these kids and keep them in a learning and being able to be productive for the year. So they're really trying to stay within the guidelines and the recommendations for that. I also know that school nurses are being more vigilant this year about letting kids stay, or if they have to go home. And they're honestly sending kids home more often for things they wouldn't have done in years past. My son has been in school for just a few weeks now and has already been sent home 4 different times for different things that in the past he wouldn't have been sent home with. He had a runny nose one day, and my son has chronic allergies and allergic to a lot of things. So he keeps a runny nose, which then makes him have a sore throat and cough because all that mucus and whatnot in there. But he's being sent home because he has a runny nose. And when I try to explain to the school, well, this is what's going on, and in years past, this is how we've always dealt, they're like, yeah, we're going to need a note from a doctor. So I've had to get a hold of his allergist and set up these things to just let him know that we know runny nose is a symptom and we know sore throat is a symptom, but these are also symptoms of allergies, of common cold, of other things. But without that note, without that knowing that these kids aren't contagious, they're sending them home more often. Again, at least we know that we're not potentially exposing other kids. But as a parent, it's a little frustrating when you're at the school at least once a week, picking up a child who's, I know, isn't sick. But I also understand why this is being put in place. Many of the schools are also letting there be a period of time that if you want to switch which option you have picked, if your child has not started school yet, but you already have them set up for in-person school, but you're now changing your mind on how you feel about if that was the right decision, there's a grace period of, okay, now you can switch them to virtual. Or just the opposite, if school starts and you're noticing your kiddos having some trouble with virtual school and staying on task, and you feel safe enough to send them in person, then that's an option too. But again, that's something you need to talk to your specific school about, and they will let you know the grace period of letting them switch from one to the other. So when going back to school, we know it's always a stressful time. Even when before COVID and all this has been going on, going back to school is stressful. There's new teachers and different classes and making new friends and changing schedule, all things that kind of, offset the way that our kids are feeling and gives them a little anxiety of change. And this is normal. So we're going to go over a little bit of tips and warning signs about mental health in our kids and how we can help them. So the facts about youth mental health, these are from the CDC website that was updated in March of 2021. And these also reflect nationwide numbers. So it's just showing kind of just approximately how many have been diagnosed with behavioral issues or ADHD diagnosis, how many have diagnosed anxiety. So it's affecting quite a few of our kids in the school. So if your child ever feels like I'm the only one, they're not, which for some makes them feel a little better that they're not the odd man out. So why mental health matters? Mental health affects the ability to learn. So our kids, they're just not paying attention. They're thinking of other things. They're being upset about other things, and they're not learning if they're not able to think about school. It affects their attendance. Are they not going to school? Are they leaving school early? Their relationships with peers. Are they able to hold relationships with other people? But are they being antisocial? Are they just emotionally distant? Are they being shy or quiet because they're having a down day and they're missing out on some things that the other students are doing? and it affects their physical health. We know that your mental health also affects your physical health. You have headaches and stomach aches, and really just not feeling well gives you other pains, and all this just affects the way students are able to learn. So then some warning signs that we can look out for when it comes to watching our kids. Is their sleep or appetite changing? Are they feeling sad, withdrawn? Do they have this intense fear of worry? Is there drastic changes in their behavior? Are they having difficulty concentrating and staying on task? And it's not just this happened once, because we all kind of feel sad once in a while. We all kind of are easily distracted once in a while. But is this stuff happening over a period of time? Is it really starting to affect their not only homework or grades, but just socially? Are they no longer interacting with family? Are they no longer interacting with friends that they used to all the time? I know for my daughter, like her not talking to family may not be as noticeable because she's a teenager, but when I notice that she's not talking to her friends as much, then there's a notice for concern. So, like I had said, when we start new year of school, that there is some anxiety, and for the most part, a lot of that kind of fades away once they get into school and they get into a routine. But if you're noticing that we're a few weeks into school and there's still a lot of anxiety about going to school or going to certain classes, it's something to really think about. You really want to listen to your kids and reassure their feelings, that their feelings are valid. You want to focus on being caring and understanding, and kind of help them ease back into a routine, or help them create a routine that's really going to help them and their mental health. And then let someone at the school know, start a really good relationship with their teachers or their guidance counselors, someone at the school that's, this is what I'm noticing at home, what do you notice at school? Or just the opposite, if someone that can easily and feel really comfortable reaching out to you about your child, saying, I'm noticing this at school and wanted to let you know and didn't know if you knew this was going on. So you really want to keep those relationships with teachers open. And it's a little harder as they get into high school or middle school, even when they start having switching classrooms, different teachers for different subjects. But sometimes all you need is to connect with one of the teachers and just being able to let them know if you can notice anything, or this is what I've noticed. And teachers tend to be really good about sharing amongst themselves, and they know your kids' schedule. They know what they're like. They know what's normal in school as opposed to what's normal at home. So again, we want to remember that schools are safe, and they're trying to keep them as safe as absolutely possible. It's stimulating for our kids. It's a really effective way of learning. It's a place for our kids and to learn social skills and communication skills and how to work together and all those things that as they become older and into adulthood, that helps them along. So we know that as things are being updated through the CDC about how this year is going to go, that schools are going to keep us in what they are knowing and what they're changing the best they can. And we just have to be patient and forgiving of them when things seem very short and abrupt, and they're trying their best to also keep our kids really safe. So we've talked about some things to watch out for our kids, but then we also want to share some connections as parents that will really help. Being able to have someone to talk to about what's going on with our families, with ourselves, is really helpful. And another way just to get really good resources and have someone else that you can talk to yourself. And you're really modeling the way of, I have people that I talk to at least, even if it's just once a month, but I get to kind of talk about my feelings and what's going on. I get some really good advice from some people that are going through the same stuff. I know the more involved I became with NAMI and Virginia Family Network, even before I was employed with them, my daughter was able to see that, I have people to talk to, I have people to get advice from, and it really helped. And now she has a lot to do with the youth move side, where she's found people that she's able to talk to and get advice and get resources that are specific for her. So these are some of the programs and trainings that Virginia Family Network has for parents and caregivers. On the first and third Wednesday of every month, we have a family support group. And this is peer-led. So you're able to connect with others who are going through some of the similar stuff. And it's a very confidential and safe place to really come and express how you're feeling and what's going on. And of course, that's on Zoom. And then we have a parent meetup that is the first and third Fridays of every month. And this is just another really safe place to have open conversations about things going on. They're not always necessarily themed, but we definitely like to talk about the concerns of what's going on now. So for our parent meetup that will be this Friday, September 3rd, we're going to continue our back to school conversation and how has school been? For some parents, their kids have been in school for a little bit, and how are things going? And for some, they'll be starting really soon. And, how are you feeling about that? And is there a way we can support you? Virginia Family Network also has a book club, which is really nice to just connect on things that aren't necessarily parent related. Our books are definitely centered around mental health and mental wellness. And sometimes it's how we can help our kids through things, but it's also being able to connect with other adults and just have conversations and make some friends along the way. And then once a month, we have a coffee chat and self-care check-in. So about halfway through the month, on a Thursday morning, we all get together and have just a really quick 15-20 minutes together, long enough to talk about some self-care and how we've been doing for the month, share some coffee, tea, whatever gets you going in the morning. And then we also have our advanced parent leadership training coming up. So this is for parents who are at a point that they're ready to start giving back to their community. When I explain it to other parents and caregivers, I kind of tell them, like, you've kind of gone down the path of working with the different finding doctors and finding resources, and you've done a lot of it, and maybe even by yourself, and you're kind of feeling like no parent should have to struggle like this by themselves. There's enough of us around that we can help each other, and you want to offer some help. So advanced parent leadership training is really good about talking about leadership qualities and how you can be a parent leader in your community. And if that means you want to learn how to lead a training, or you want to learn how to lead a support group, it's there. Or it's really easy things like, I'm just going to make sure my community is in the know about upcoming information. And then here are the resources that's been put together for the Lunch and Learn today. A lot of these were used when making this PowerPoint, and then some things are just really great resources that we have. The the NAMI Virginia resource page has lots of information about back to school and other resources that we have found, and it's ever growing. Virginia Department of Education, which was a lot of help when trying to find some information to share. Forms Family Forward is a great organization that we work with a lot. And Pizzi is also one of the great resources that we work with quite often. So I want to thank you for sharing your afternoon with us. I hope you have learned a little bit about going back to school and helping our kids with anxiety. If you have any questions, any comments that you would like to make, you can put that in the comment section below. If you would like a copy of our resource list, you can email me, just let me know and I will get that to you. I will add my email address to the comment section below so you can ask me anything. And if you want any more information about any of those ways to connect, Zoom links, ways to register, anything, again, just email me and I will make sure that we can get you connected. Hope you have a great rest of your afternoon. And again, thank you for sharing your lunch with us.